Hi again, this is Dr. Badawi from Westlake Dental Care. I am here today to talk to you about something quite serious, which is implant failures. I hope this helps anybody out there who is watching avoid costly dental mistakes or errors. So, most dentists don't talk about failures. As most lecturers on the podium, they only discuss their great successes, but nobody talks about failures. Sometimes, however, it's more important to talk about those failures. Implant dentistry is something that's been around since 1983. The first dental implant was approved for use in the United States. So we have about 35 years of research on implant dentistry here in the United States. Of course, there's research from before that, but really what we know clinically is from the past 35 years. And really in the past 10 to 15 years has it become so popular for people to get dental implants to restore their missing teeth. And we are starting to see the complications associated with that. So I'm here to talk to you about 5 main reasons why dental implants might fail. The first being metabolic. That is really important. Metabolic means something that's going on in your body causing that implant to fail. And if the implant fails, the implant will typically come out on its own. One main metabolic reason for losing dental implants is diabetes. So if you're a diabetic, you might want to look into your HbA1c levels, your glycosylated hemoglobin numbers. If your A1c levels, in short, is 7 or below, you are qualified to receive a dental implant. So your diabetes should be in control before receiving a dental implant. That way you reduce the risk of the implant failing and coming out on its own. The second reason for dental implant failure, and of course doctors will agree or disagree, it has been proven to be smoking. Smoking increases the chance of implant failure, and this is a really simple reason why. Dental implants need good blood flow to heal. The nicotine constricts the blood vessels, which doesn't allow the implant to heal with the bone. The blood flow is compromised. So if you are a smoker, you want to quit smoking 3 or 4 weeks before you receive your dental implant, so the blood supply can return to the area and you have a bigger chance of the implant integrating with the bone. Another reason is actually unknown. Sometimes they just don't take. It is a very small percentage of patients where we actually cannot pinpoint to the exact reason why the implant failed. Sometimes they don't take. It could be something metabolic going on, it could be vitamin D deficiency, which in the latest breakthrough research, it has been proven that early implant failure can be caused by vitamin D deficiency. So you want to have your vitamin D levels tested. We test vitamin D levels here in the office, or you can test it with your primary care physician. And we also offer vitamin D supplements that will get you to the optimal level. If you are low or deficient in vitamin D, we can get you to the ideal level for surgery, which is 40 and above, 40 to 60 of vitamin D3. The fourth reason is insufficient bone. Sometimes the doctors might want to try to place a very short implant because they're in close proximity to the sinus, or a narrower implant because they haven't grafted the area. It's best to actually have your provider graft the area, make it nice and bulky, and a good foundation to place your dental implant. So you want to go to somebody who's not afraid to graft the area, so that way you can get a standard size dental implant that has a higher chance of success. The fifth reason is surgical error. Unfortunately, that can happen. Sometimes a less experienced provider might run into errors or complications and they cannot correct it during the process, or might make some decisions that are not in the best interest of the patient. All that being said, and it's been said that dental implants have a 99% survival rate. I think that the statistics are showing that it is much lower than that. It is at 97% survival rate. So maybe out of 100 implants, 3 might have been lost. So this is something that you need to be informed about, and your doctor should not be afraid to tell you about this. So what happens when you lose a dental implant now? Well, typically the area can be cleaned, grafted, and most of the time, a second attempt to place an implant is successful. So just in case you have lost an implant, if it was not for metabolic reasons, chances are that you can have that implant replaced. I hope this video helped you. Please like it, share it, tag your friends. This has been Dr. Badawi with Westlake Dental Care. See you later.